Hi, I'm Dr. Beth Botts. I'm a child and adolescent psychiatrist and the Associate Training Director for the University of Utah, Idaho Rural Training Track. In rural areas, jobs can be more physically demanding and more financially risky. Folks can be more isolated from their neighbors and their friends. There's also a lack of resources, and it's more difficult to get into clinics or to find people who can help. A big part of the challenge is mindset. Folks in rural areas often pride themselves on being self-reliant, and while that's a really good thing, when we are able to reach out and get help for mental health issues, it actually makes us stronger. Well, really, I think it's twofold. The first is that we really need to destigmatize the conversation around mental illness. We need for people to realize that it's okay to reach out for help. Our mental health is really tied to our physical health, and we have to take care of both. And I think the other part is increasing the access to healthcare in rural areas. And this needs to be done in a number of ways. We need to get physicians in more rural areas. We need to improve on telehealth and other ways to bring physicians to the rural areas as well. There's a large rural population in Idaho and in Utah, and Huntsman Mental Health Institute has a specific training program for rural psychiatrists. They spend their first 2 years here in Salt Lake, but their last 2 years they spend in Pocatello, Idaho, fully immersed in the rural communities. What we know is that physicians tend to stay where they train, and this is a perfect way to give them not only great rural training and how to do that in areas that might lack resources, but it's also a good chance for folks to stay there and provide healthcare to the community.